Difference between rheumatoid arthritis and ankylosing spondylitis. Look at this X-ray findings. What is rheumatoid arthritis? It is an autoimmune disorder causing chronic inflammation of the synovial joints, leading to pain, swelling, and potential joint deformity. What is ankylosing spondylitis? Ankylosing spondylitis is a chronic inflammatory disease primarily affecting the spine and sacroiliac joints, leading to pain, stiffness, and eventually fusion of the vertebrae. Difference between them. One definition: rheumatoid arthritis, an autoimmune disorder that primarily affect the synovial joint, causing chronic inflammation. Ankylosing spondylitis, a chronic inflammatory disease that primarily affects the spine and sacroiliac joints, leading to fusion of the vertebrae. To primary area affected, RA mostly affects peripheral joints like the hand, wrist and feet. AS primarily affect the spine, sacroiliac joints and sometimes the hips and shoulders. 3. Age of onset. RA typically begins between age 30 and 50. But AS usually starts in late adolescence or early adulthood between age 15 and 30. For gender prevalence, RA more common in women, AS more common in men. 5 symptoms: RA symptomatical joint pain, swelling, stiffness and fatigue. But AS back pain and stiffness, especially in the low back, buttocks, which improves with exercise but not rest. 6. Morning stiffness. RA morning stiffness lasting more than 1 hour. AS morning stiffness that improves with movements and exercise. 7. Joint fusion. RA joint deformity and erosion are common but not typically fusion. But AS fusion of the vertebrae, leading to loss of spine flexibility. 8. Systemic involvement. RA can affect other organs such as the lungs, heart and eyes. AS less commonly affects other organs but can lead to eye inflammation and heart complications. 9. Genetic marker. RA associated with HLA-DR4 and other genetic factors. AS strongly associated with the HLA and B27 gene. 10. Radiographic features. RA X-ray shows joint space narrowing, erosions and osteopenia near joints. AS X-ray shows sacroiliitis, syndromophylitis, eventual vertebral fusion. 11. Inflammatory markers RA, elevated ESR and CR, positive rheumatoid factors RF, and anti-CCP antibodies. AS, elevated ESR, CRP, and RF, and anti-CCP are usually negative. 12. Treatment RA treated with DMARD like methotrexate, biologics, and anti-inflammatory medications. AS treated with NSAIDs, TNF inhibitors, physical therapy, sometimes DMARD. 13. Joint deformity RA, common to see joint deformities such as ulnar deviation, swan neck, and bitoneer deformities. AS, less common to see peripheral joint deformities but severe spine deformities can occur. 14. Impact on mobility affect fine motor skills due to small joint involvement. AS lead to reduced flexibility and mobility of spine. 15. Diagnosis RA, diagnosed based on clinical criteria, blood test, imaging. AS, diagnosed based on clinical criteria, imaging, and genetic test for HLA. Beat 27. Thank you. Have a nice day.